And joining me now to continue that COVID conversation, we got Dr. Ben Weston. He's Associate Professor of Emergency Medicine at the Medical College of Wisconsin. Dr. Ben, it's a pleasure to have you. Thanks for stopping by to chat with us. So, our reporter, all inbound travelers must test negative 24 hours before entering the U.S. How are these tests being confirmed to ensure that the person actually taking that test is the person arriving here in the U.S.?
Yeah, thank you for having me. So that's going to be one of the critical questions. We have thousands and thousands of people coming in and out of this country every day. So it's going to be an enormous effort. It'll depend on everything from the CDC down, but especially our local health departments to follow up on those people, make sure that they're getting their tests, see what the test results are, and go from there.
Well, we had our chief medical editor who basically talked about how you can test negative one day, but then days later actually be positive. So, I mean, are there any procedures once that traveler is here in the United States to follow up?
So that's why it's so critical to not just have that single test, but really think about a quarantine period and think about multiple tests. So just as you said, day one, the test can absolutely be negative, but by day two, certainly by day 5, you may have a positive test. And so that's why, just like any other significant exposure, when you're traveling, when you're around a lot of other people, you're in a foreign country, or in this country, as much as COVID as we have here, you want to think about a quarantine period before you're going and interacting with others. And it also takes into account how important mitigation measures are. Wearing masks, keeping your distance, keeping ventilation, these remain as critical as ever.
Yeah, so do you believe that, I mean, as a healthcare professional, that the White House needs to implement that? Because right now that's not on the table.
I think we need to look seriously at quarantines. A lot of countries have this when somebody comes into the country, quarantining them, watching them for a little bit, certainly asking them to do multiple tests and then following up to make sure that they do.
All right, Dr. Ben, what concerns you about this new Omicron variant? I mean, I know we still don't know a lot about it, but what are you most concerned about, sir?
Well, I think there's two things that are concerning. One is what we do know so far, which is that it certainly seems to be much more transmissible. Of course, we don't know about severity. We don't know about vaccine effectiveness. And then the other thing that's concerning, we've known this for a long time, is that this is probably not the last variant that we're going to see. We see major issues with vaccine equity on a local scale, but especially on a global scale. Some countries are in the single digits or less for their vaccination rates. And as long as that continues, we're going to keep seeing more and more variants like this.
Yeah, I interviewed a doctor earlier, Dr. Yolanda Hancock, and she had mentioned there was new information released on Sunday stating that the Omicron variant is 3 times more infectious than Delta, which was what, spreading up to 7 people or something like that every so many days. What does that mean for us going into the winter months?
So we've really seen 2 items of information on Delta. One is absolutely that it does seem to be significantly more transmissible. The other one, and this is initial data, but it seems that it's reinfecting people at a higher rate. So people who in the past may have depended on that illness-associated immunity, sometimes called natural immunity, may not be as effective against this variant. So what are the implications? Well, it depends on what the severity is, and it depends on what that vaccine effectiveness is. We'll probably know that in the next week or 2, or at least have a much better idea. But it means that COVID is not over. And even if it wasn't for the Omicron variant, states across our country, and certainly countries around the world, my state included in Wisconsin, are suffering significantly under the Delta variant. Forget about Omicron. Delta is giving us higher hospitalization rates than we've seen at all in 2021 so far. So we certainly have our hands full right now.
Yeah, Dr. Ben, I mean, you think about where we were when this pandemic started, right? And here we are, hopefully almost toward the end. We have the tools that we need, but yet we're seeing cases surge across the country, 100,000 new cases a day. I mean, how upsetting is that for you as someone who has been so hands-on since this pandemic started? You must be exhausted.
It is frustrating. It's frustrating to know that, as you said, we have the tool to end this. We really have the silver bullet. You couldn't ask for a better vaccine, more effective, more safe than what we have right now. We just need to get more folks to take it. So we'll keep breaking down those barriers, keep working to get people vaccinated.
Yeah. Any last minute pleas to folks? Because, I mean, we still have millions of people who aren't. We got about 20 seconds.
Yeah, I think there's 3 things you can do. Number one, if you haven't yet, I hope you have, but if you haven't yet, get vaccinated. Just get that first dose and get some protection before Omicron comes, before it becomes more widespread than it is. Number two, get your booster. The evidence for boosters is increasing. It really does increase your immune response. And number three, remember just the core measures of mitigation: masking, distancing, and ventilation.
All right, Dr. Ben, thank you so much for stopping by BNC Live to chat with us, sir. It was a pleasure.